Hello and welcome to This Week in James City County. I'm your host, Renee Dahlman. Today I am once again joined by Scott Stevens, James City County's County Administrator. Welcome, Scott.
Well, good morning, Renee. It's sort of a high from the Zoom world, right?
That's right. How are you?
Doing very well, thank you. I think the nice weather just lifts my spirits. I like springtime and summer, and we're certainly into that. Amidst all the other stuff, spring and summer still here, so it's nice.
And I have seen the forecast for later this weekend. We are definitely going to get summer.
Yeah, it looks like summer is showing up, and that'll be good for some like me, and maybe not as good for some others, but it's moving along anyhow.
Just like it's supposed to.
That is right.
So I know there's a lot of stuff you want to talk with us about this morning. So you want to just take it away?
We'll almost turn it into maybe what used to be our podcast when we looked across the table at one another.
Right.
And I thought I would go over some of what the board's done over the past couple months, really. We haven't spoken to that specifically. Thought I'd talk a little bit about our budget and just the process of where we are. And then I'll finish up with sort of COVID and sort of where we are today and see how that goes. And so, really going back, we started all this sort of pre-COVID meeting was like for us, March 10th with the Board of Supervisors before we closed county offices on March 13th. So back on March 10th, the board did a contract award funded by the Williamsburg Health Foundation to study the organizational alignment of Colonial Behavioral Health and Old Town Medical Dental Center. So they were trying to see, is there a better way for those two organizations to function separately or together? And again, I think it really will be a good outcome for us in terms of finding out the best way to provide those services for the community going forward. So that was really a significant item back on March 10th. A few other items, but that one I thought was most significant. They also approved temporary classrooms for Stonehouse Elementary and Jamestown High School. And I do think we'll be back in schools eventually, and the need for those classrooms will still be there. So they did approve that. March 17th, they held a special meeting. It was really, we again had closed county offices to the public March 13th. Our county employees continued to work. But March 17th, they held a special meeting to confirm and adopt an emergency declaration. We did a COVID update. And during that meeting, they did waive the credit card convenience fees for those that pay for county services, whatever it might be. With credit cards, where we normally charge the 2.9% fee that we're charged by the credit card companies, we waive that to make it easier for our residents to pay the county for things that they are receiving. And they waived it at that time until June 30th. That has since been extended to August 5th. So again, but they have waived credit card convenience fees. March 24th, we had an emergency ordinance that really was adopted that allowed a remote or virtual meetings of the board. Our board has not chosen to do that at this point. They have met in person with Ms. Sadler meeting remotely, but they do have an ordinance that's in place that would allow remote or virtual meetings of the board. And so many communities through Hampton Roads are doing that. Our board has not felt the need for that yet. And again, we do have them spread out in the boardroom. So I feel very comfortable between the cleaning, between the spacings, between limiting those that are in the boardroom, that we are very low risk, and we've been following the general guidance of social distancing. March 24th, again, emergency ordinance, same one, COVID update. April 14th was a regular meeting for them. They held a public hearing on our proposed county budget, amongst other things. We had a few call-ins. It was a process where we weren't letting the public into the building, but we still took public comment. So that was an interesting public hearing for us, and it was really at the early days of all the COVID discussion and trying to figure that out. We did change county health insurance administrator for employees. So for county employees, our health insurance will be changing from Cigna to Optima, again, effective July 1st. And again, for those in the world, we are self-insured, so it's really just the plan administrator, but it goes along. It'll look like we changed from Cigna to Optima. That was an April 14th board meeting. April 21st was a budget work session, and I'll talk about that more with the board as I get through the end of this. May 5th was another budget work session with the board, so we've had a lot of meetings with the board through all this COVID time. And then May 12th is an upcoming regular meeting, and we're doing this podcast ahead of that. So we're meeting on Monday with this video, and then the board will meet on the 12th. But I wanted to at least share what they will be doing there and where at least what they'll be considering. And the first, we've got it listed as workplace safety. That's really how it started on their agenda for May 12th. But it's rolled into really more of a COVID update, talk about county facilities reopening, talking about hearing from our Parks and Rec, our social services, our courts, and our general services and Parks and Rec. I think so. You'll hear a lot more about what's going on related to county facilities and things within the community at the May 12th meeting. And then the board did discuss at their May 5th budget work session a business grant for the community. So they have got an item on their May 12th to consider where they would appropriate $500,000 from it's really leftover CIP projects. So it's money that wasn't in the current budget or in the proposed budget. It was some projects from years past that had closed out and were done, and this was excess funding or leftover funding from those projects. So they have that item to consider, and they were going to use the VA 30-day fund where businesses could apply. You have to be pretty specific to be Jamestown business, been in business a year, and it's a fairly straightforward application process to get a $3,000 grant. So
now, Scott,
yes.
Let me interrupt. You said a Jamestown business or a James City County business?
Sorry, it's a James City County business. Thank you, Renee. I assume folks would get that, but I absolutely meant James City County business. I
was just wondering if people were out there, well, who are barrel makers? Who would be able to, so anyway.
Somebody would ask, so I appreciate the clarification. And again, the $500,000 will provide $3,000 grants to 166 businesses. So it doesn't get everywhere, but it certainly will help some. And I do think those funds can make a difference. And then one other thing we've got that benefit county employees is we have employees that were hired, I guess, since 2014 get paid time off versus vacation and sick leave. We have recommended back, and the board will consider giving those employees 4 days of sick leave on an annual basis. And then all employees, they would be considering adding a floating holiday. When we look at Hampton Roads and sort of what we compete with for talent and employees, most of the localities in Hampton Roads, including the state, do greater than 13 holidays a year. James City County does 11. This floating holiday will bring us up to 12. So we'll still be behind, but at least catching our employee group up a little bit. So I think that's a quick summary of about 6 meetings and another one to come. So anyhow, board has had a lot of activity through the past 2 months. I wanted to mention a little about budget. I mentioned a number of budget work sessions and discussions with the board. The current year budget, when we talk about that, that's FY20, and our year runs July 2019 to the end of June 2020. That budget this year, we're expecting a $7.6 million shortfall in revenue. All of this impact that COVID has had, primarily in sales tax, but some in hotel, motel taxes, and meals and taxes as well. But about a $7.6 million shortfall in our current year, which is around 5%. It's not quite 5%, but still a significant drop in money. That is something that will be shared about 50-50 between the county and the schools in terms of getting our budgets put together. So again, we are working on that. Doesn't dip into our savings or our fund balance. It's not a rainy day fund. It is something that helps us with liquidity and being able to pay the bills. And it is something that $30 million is that fund balance number, a little over that. It's a good number, but it's not excessive. And so our goal on it from the finance side and from county administrator side is not to spend that money. We need that money for a reoccurrence if this comes back or some other significant event such as a hurricane that we haven't or a bad snowstorm or whatever might occur in the community. Saving that fund balance for that type of an event is important. So that is where we are in the current year. We expect to make up that shortfall within our operating budgets. Next year, as you get into what we call next year's fiscal year 21, we had developed really a pre-COVID budget, as most localities had. We had not put it out until we were well into this. We put it out, I guess, early April. So we were into this when we put the budget out. Our discussions with the board was all about starting with proposed and having options back. So we did look at really 5 scenarios with the board. The proposed budget, then we reduced 5%, 10%, 15%, and 20%. And after a lot of conversation, the board has settled around a 10% reduction, which is almost $22 million. And so that's pretty significant in terms of dollars. And again, 10% on the budget. In doing that, we share that with the schools. So there's been a lot of conversation about we shouldn't reduce school funding, but there's not a way not to. I mean, the challenge is when we bring in $20 million less revenue is what we're projecting. You can't pull that out of the county operating budget all by itself. We really get down into our operating side after debt payments and some sort of fixed costs. We have about $70 million. To pull $20 million out of $70 million is almost what's impossible to do without people. So we'd have to do it through furloughs or something else. And with our 10% reduction on the county side, we're talking about no furloughs of full-time staff. On the school side, as I understand with the superintendent, they have a few positions that they're trying to work through. And I say a few, it was less than 20 positions to furlough at that 10% range. And we were trying to figure out for them, really theirs to figure out, can they do it differently? So it is significant in terms of cut to capital and cut to some operating kinds of things, but they're cuts that if it rebounds and the economy is better than we expect come the fall, then we can amend the budget at that time and provide more funding to the schools or more funding to the county department. So the board has normally adopted their budget. Again, we had set them up to adopt it May 12th. They have pushed that out to June 9th just to see if there's any more information related to the impact of COVID on county finances. But the real reality for us is that sales tax and those kind of collections are delayed. So we don't know the results for 2 or 3 months after May or after March. So we'll have a little more information in June, but we won't really have a good idea of the impact on the county revenues until July, August timeframe. And our commitment to the board with any budget they should adopt is some more regular financial reporting from us. So they'll see month to month what's going on, and the community will see that as well as we go forward. We probably will do a budget update at every other work session at a minimum so that the board sees and the community what's going on with county finances, and that we're either tracking as expected or we're above or below, and make adjustments as we go along. So I think that's enough on the budget. There's certainly, I would encourage people, if they want to see more detail, there was a lot of conversation at our April 21st work session with the board and our May 5th work session with the board. And then again, June 9th is when they do anticipate adopting. So I would ask community, if they have questions, don't hesitate to call. I'm happy to talk with them. It's 253-6603. Again, 757-253-6603. If you have questions on budget or anything else related to county, I'm happy to talk about that. We talk about the impact of the county budget because that's the part we control. But I can tell you from myself and the Board of Supervisors, we are very concerned with the impact COVID's having on the business community. It's really less about the revenues for the community and more about, we know that we're having less revenues, the businesses are really being impacted. And that's where their empathy has been. They do understand that. They're very concerned with that. And again, we talk about our finances we control, but it's not just about money to provide county services. It's about the community as a whole. So again, June 9th, we'll see what the final budget looks like and expect them to adopt something at their meeting then. Anything I miss on budget, Renee? You've been part of these conversations, so.
I think you covered it. It's just, we're still looking for input, right?
Correct.
So definitely give you a call. I'm going to have a website and other information for folks at the end of this video.
That's exactly right. That's exactly right. And again, we do have a savings or a fund balance, not a rainy day fund. It's not a time to dole out a significant part of that. There may come a time, it's just not yet. Okay. So, the last thing I thought I'd talk about is what we've really all talked about for the past 2 months, and this is a COVID-19 or our coronavirus, and we all have learned an awful lot about that, I guess, over the past few months. You know, as of today, May 11th, we have 173 cases in James City County. We have 15 deaths attributable to COVID. So we started as one of the highest rates in Virginia. We still are pretty high based on population, but it has spread across the state to where at this point, there are over 167,000 cases and over 800 deaths. So again, we still have our part in terms of those numbers, and that really is tragic for the families that have lost somebody or have not been allowed in the hospital because of this. I mean, there have been people that have had other issues within the hospital who have had to go through those alone because family's not allowed. There's just a lot of stories locally and nationally that are just heartbreaking as you go through this. And I do think the pause that we've gone through, I know from our standpoint, we are much better prepared locally as your fire and EMS and police from a equipment or personal protective equipment of masks and gloves and gowns. We are in much better shape today than we were 2 months ago. So this pause for a couple months has definitely let the supply chain on that side catch up. We talk with the hospitals almost daily and hear sort of reports from them. I sense the same thing from the hospitals in the peninsula area. They are in much better shape today. And we had talked about staging up some temporary hospital space. Those talks at this point or plans have been suspended. So there's still the ability to, but there's not perceived to be the need to. So for us here in the Hampton Roads and particularly the peninsula side, I think we're in really good shape from a medical standpoint to handle cases that may occur. And as the governor talks about reopening, the UVA models that we've talked from sometimes all show an increasing in cases, which makes sense. If we all start going back out and mixing together again, you should expect more cases. But I, for one, feel the medical system is much better prepared to handle it. So 2 months ago, I think we would have overwhelmed the system. Today, it looks like we are in much better shape. So we'll see how that goes along. I mentioned before at our May 12th, the Board of Supervisors meeting, that we have an update on social services. We've talked a lot about homeless. We've talked a lot about increased benefits. We've had our staff, although working remotely, many of them, they have been extremely busy with processing benefits, as you might imagine, because there's been a greater need. We've also, our courts have been open, but Nate Green, our Commonwealth attorney, had agreed to come and sort of give the community an update on what's going on in the court system and what does he see coming in the coming months as we reopen things. And the courts still are in operation, although on a limited basis, and he'll have much more detail to share there. So I think that will be helpful for folks. We've got a general services department that probably, at least as people return to our buildings, has been doing a great job of putting in hand sanitizers, up in the cleaning. We are, our cleaning staff is all over our buildings a couple times a day. And again, I think for those that have been in the building, that makes us feel better. For those returning to our buildings, I hope that'll help ease their sense some. And then Parks and Rec, we spent a lot of time. We've never fully closed our parks, although we did close tennis courts and pickleball courts and basketball courts and our rec center and our campsites, and our swimming pools hadn't opened yet, and our beach. And so there's things we've got closed, but our parks have been well used throughout this. And by and large, community residents have adhered to the requirements of social distancing. We've had staff that have had to ask the occasional group to break up, but I do appreciate the patience of the community. It is frustrating when you're not allowed to go out and play soccer or to be with a group of friends that you want to be with. And so I think those things will get better. Our parks have been a really good outlet for people, and I would continue to encourage people to visit our parks, particularly as the weather is getting better. We have reopened a portion. We opened tennis courts and pickleball courts to singles play. Again, we're doing more with camping as we follow what the governor's doing. We didn't have to follow the state guidelines on the camps, campgrounds and those kinds of things, but we have tried to. And so we'll look forward to reopening some of our campsites at Chickahominy, Riverfront Park, and we'll continue to look for opportunities to reopen our facilities in a safe manner as time goes forward. And again, we are talking with other localities around us to try to do similar things. In some cases, we're doing the very same thing. In other cases, we're not, but at least we are aware of what the others are doing. And so we're making those decisions really together, knowing that some of us have a little higher comfort level or feel like it's safe to do some of the things that we're doing, staffing and otherwise. So I think you'll have good detail from that May 12th meeting. We are talking about, there's been discussion in a number of our meetings about reopening things from our board. The authority we have is to really reopen county offices. And so what our board is trying to do is just promote a safe reopening of businesses. And that's where the governor's headed. But that's been really the message from our board, is trying to make that happen sooner than later. And so when we talk about reopening things, what we as the county can control are our facilities, our parks, our buildings. And on May 12th, we'll have laid out a plan of what we see for reopening county offices. We'll have some of our buildings the public can walk in as they used to. We're going to have other buildings where you probably have to make an appointment so that we know who's coming and we're prepared for you. And we don't just have you sitting in a waiting room with a number of other people, that we do it by appointment only. But we are talking about how to get us open. We've been working, but we're trying to make sure the public is able to get back into our buildings when needed. We've had employees that many have teleworked, so they've been working remotely. While they haven't been in the offices, I still believe we're getting very good production out of most, if not all. And I know some we're getting more production out because 5 o'clock doesn't ring the bell, so to speak, where people start leaving. And all of a sudden they tell me it's 6 or 7 and they've still been working. And I know Renee happens to be one of those, at least in the early days, spent a lot more time working through all of this, probably because she was remote. It just didn't ever seem to cut off. So we are talking about how to get our employees back, a phased bringing back. And so we'll work in the week of following now of bringing more and more people back. We're already more people in my building. There are more people in our treasurer and commissioner of revenue's offices. We will continue to do that over the coming months, allowing telework and shared space and social distancing. And then there may be some positions where people have health issues that we really let them telework longer, or the job just really makes sense. And so telework has been as productive. We were doing telework with social services ahead of all of this. We started that last fall, really as in a response to not having enough building space and more work to do. And so I think there'll still be some opportunity for telework into the future. But over the coming months, we'll have more and more of our staff back in our buildings, regain their comfort level of being here and continue to do that in a safe manner. One ask of the public that we're not going to require, but it will be strongly recommended, is wearing of masks. And I think that's awkward for a lot of us, myself included, but I've tried to do better when I'm in public of wearing masks. And it's one of those things, it's not so much about me, as I understand, it's more about me protecting others from me should I be a carrier. And so we are not going to require masks at this point in our county facilities as they reopen, but we are going to strongly encourage them. So I would just encourage the public to try to bear with us and do their part in being as safe with all of this as we can. And so the governor's executive order 61, which was, I guess, released on Friday, talked about a phase 1 of reopening businesses, possibly to begin as early as May 15th. I'm extremely hopeful that'll happen May 15th. I know we have a lot of businesses here that are very hopeful that'll happen May 15th, but it really is incumbent upon all of us to do the right things, to not just mob a place, to make sure we maintain our social distancing, to wear a mask when asked or requested, and to just be responsible in trying to get it back open so that we don't have an increase in cases above what's inspected and that would overwhelm our healthcare system. So I think it's really important that we get businesses back in business, so to speak, and we look forward to the first phase occurring and then moving beyond that. For those that haven't gone to the Virginia Department of Health website in a long time, and there's a link off James City County's website, they have gotten more and more information, more locality-specific information, and a lot of data out there if you're interested to see what's going on within the Commonwealth and James City County. So, Renee, anything that I miss on COVID?
I don't think so. I think you did a great job covering it all.
It's more than enough, I hope, or more than enough for this Zoom podcast, right? So I would say if folks have questions, again, please don't hesitate to call. We're happy to talk at any time. It's 253-6603, or you can email. We're happy to be here and try to respond to questions and make sure the community knows that we care, because we do. And your input does matter. I would tell you, as we go through these reopening, we have people that have contacted us at every step we make to reopen. They are really, really, really concerned about the health and safety of their friends and neighbors. And then we have other residents who feel like we should have been open months ago. So it's one of those things that we're trying to do a balance of what makes most sense based on guidance we can receive that gets us back into a quote normal, whatever that turns out to be as we go forward. So again, I do hope folks will get out and enjoy the weather. It really is a nice time of year. And for me, it looks to get nicer in the coming weeks. So what next, Renee?
I think that you have covered it all. The only thing that I can think of are elections that are coming up, because it's going to be a little different in June. So if you want to talk about that's fine, but I'm also going to have Diana Moorman, our voter registrar, come on, and she's got all the dates and all of that. So
well, I think I'll leave the details to Diana, because she certainly is the one in charge of all of that. I would tell you that we will have polling place open. We are encouraging absentee ballots. The more we can do, not being face-to-face, the better. And so I would certainly encourage our public to get out there. I know they're doing that. I talked with Diana recently. She indicated that there's been a good response so far. And I would just encourage our voters to get involved, stay involved, and we'll see what happens in June.
Absolutely. And that's a key point, that our elections are in June. The city has elections in May, but we are not until June. So.
That's correct. That's correct.
All right. Well, anything else?
No, I think that's enough. If residents have questions or concerns or whatever, call us. Again, 253-6603, and we'll be happy to get in touch with you.
Absolutely. Well, thank you, Scott. Once again, one day we'll do the podcast like we used to do. I don't know when that day will be, but we will.
We might get so comfortable at this just becomes the new normal.
Who knows? Who knows? Well, thank you, Scott. Well, that wraps up this episode of This Week in James City County. Thank you so much for tuning in. As always, please take a moment to subscribe. That way you'll never miss one of our podcasts. This is a little different though, because it's video. So you'll want to go onto youtube.com/James City County and subscribe there. So that wraps it up, and we will talk with you next week.